Good afternoon, everyone. I'm Governor John Carney. Welcome to our second of our press conferences this week on Delaware's response to COVID-19. We appreciate you taking time in your day to get this update and to listen to some of the information that we have. We're in the process of our rolling reopening of Delaware's economy in sectors that have been closed down now for 3 months to one degree or another. There are certain sectors like construction, lawn care, and the like that we did not close down, unlike other states or other sectors that have been hit really hard. Our restaurant, the bars and restaurants and hospitality, tourism industries in particular have been hit really hard, and I was on conference calls this week as we normally do and heard about the financial difficulty that they're experiencing and the challenges that they face as we allow them to reopen with limited capacity to enable to bring people back to work. And they're obviously very excited about doing so. And to those of you who have a favorite restaurant, we would encourage you to do that, and to whether you do it at takeout or whether you go in and practice appropriate protective measures for staff and for other customers, but to help our small businesses come back online in a way that's safe and enables them to get revenue and thrive again. As I think about the challenges that we face, and I get a lot of questions from folks, and those questions become more pointed and lively as the days and weeks have gone by. And on the one side, this week in a conference call I had with a number of other elected officials, they were challenging me and us, our team, for whether or not we're moving too quickly to reopen the economy and some of the interim measures that we've taken in phase one, which will start officially on June the 1st, which is Monday, just after the weekend. And then I hear on our conference calls with business sector leaders and others that we're not moving fast enough. And so maybe we've got it exactly right. I don't know. History will tell. What I do know is that you have to have both. You have to have a healthy community in order to have a healthy economy, and you can't have a healthy community without a healthy economy. It's not an either-or proposition, and our effort has been simply to balance those really important objectives, to have a strong economy, to enable businesses to come back online now and to thrive, and to make accommodations along the way, thoughtful, but driven by public health science and all the things that are in the guidance that we put out for phase one, starting on June 1st, to Monday, and as well as other sectors that we're opening up, and interim measures that have been we've taken over the last couple weeks, and even with those industries that were allowed to operate over the last several months. When you get right down to it, we need to protect each other in order that everybody can thrive. And so fundamentally, this is about everybody realizing that we're all in this together. It can't be an every man for him or herself proposition. I say that on, and because we rely on each other to prevent the spread, and that's what the shutdowns were all about. I think any honest assessment about the success or not of the last 3 months in every state across the country is if you were able to shut down and sectors of your economy, protect people, particularly vulnerable. We've learned, we knew from the beginning, but certainly learned that the most vulnerable population are our frail senior citizens, particularly those that are very old and frail and in nursing homes, and protecting nursing homes has to be and is one of our main priorities as we reopen. We know that that COVID-19 infection gets into the nursing homes through the workers that work there, and that's why we've committed to testing all of those workers on a regular basis, because that's a key part of the next phase and something that we really need to be strong on. We also know that if people let down their guard, and I know of specific instances of individuals who had a larger gathering than what was allowed, and somebody in the group was COVID-19 positive, and then you have others in the group that need to be tested and that are at risk of being COVID-19 positive. And that's how it can happen. And it will happen, and it's happened in other states. And we need to do everything we can to make sure it doesn't happen here so that we can contain the spread and protect the most vulnerable population. And that's the objective. That's what everything that we've been doing has been designed to achieve. That's what the objective has. And obviously there's been a big price to be paid. As I said earlier this week, I was really encouraged by what I saw in the beach communities over the weekend, over the Memorial Day weekend, with respect to the various protections that are in place, requiring mask wearing on the boardwalk in Rehoboth Beach. Almost everybody I saw was wearing masks, and social distancing on the beaches, which was being observed pretty universally. Of course, it was not a great weather weekend, and the weather doesn't look great for this week, although probably a little bit mixed. But again, the message is, let's not waste all the sacrifice that has been made over the last 3 months by being a little bit cavalier about what we do now. And so with that, let's move into the slides and the deck, and just to go over and emphasize some of the points that address questions I get on a regular basis, like why the number of positive cases keeps increasing. Why are we reopening the economy? And part it's because the number of positive cases as a percentage of the number of tests is actually going down. We still see deaths increasing, and that's more a function. It's certainly a lagging indicator. It's more than an indicator. Obviously, it's a very sad part of this whole thing, the saddest part of the whole thing. And as the nation approaches 100,000 killed, it's just a horrible reality. But on the other hand, most people recover. You see there the 5,100 recovered, and we don't hear from everybody that recovers. And so I've been looking at that, the number of positive cases taking out the number recovered, and it's kind of flattened out, stabilized around 4,000, which I think gives you some indication of things flattening out. We certainly see it on a day-to-day basis. 183 current hospitalizations is down again. We peaked at, I think, 337 about a month or so ago, and that was considerably below our overall surge capacity in the hospitals in Delaware. And again, our thanks and appreciation goes out to the hospitals and their leaders and their employees, particularly those on the front lines, for the work they've done really at great risk when you think about it, being exposed to COVID-19 and taking care of critical patients and screening out those who are unconfirmed initially as of COVID-19 positive. So we're down to 183, comfortably below where we need to be to assure critical care surge capacity. We still are seeing a little bit more of a uptick in as a percentage of the overall in Newcastle County at 3,600. Kent County remains pretty constant at 1,400, and then the high water mark in Sussex County at 4,100. And I think, again, the important part to remember here is that notwithstanding the number of cases, the number of hospitalizations has decreased as well, again, in Sussex County. And the number of deaths in the population most affected is at a small number as a percentage. I think the number of deaths was 7 or thereabouts. It was about 7%, 7% of the deaths statewide. And of course, every single one is a precious, blessed life but it is an indication that the COVID-19 sickness among those residents of our state has not been as severe in terms of hospitalizations and in terms of deaths as it is in other places. And really, when you really think about what you have to do, you just keep coming back to protecting seniors, very, very old folks in nursing homes and in care facilities like that. Again, very few cases among children and teenagers, mostly concentrated in middle-aged folks, but the most vulnerable, again, 65 and older. Here's our dashboard. Everything still continues to move in the right direction, getting to a point where it'll probably, I guess, stabilize, and I don't know that it'll ever go away. In fact, all the science suggests that it might, with the lessening of the restrictions, there's the risk of it increasing. We're going to encourage folks to follow mask wearing and social distancing so that does not happen. That's the way we're going to control the spread. But this is the dashboard that gives us some level of comfort, a level of comfort that we can move forward. And again, the hospitalization rate, the two top charts to the left that are the biggest indicators there. All the personal protective equipment inventory is strong. AJ, that seems to be something that's one of the bright spots. Is there something you want to comment there on?
So not only is the state supply a little bit more stable now, but I think partners from Dr. Tay's team reported out yesterday that even the hospitals and healthcare system overall seeing about 60-70% rate of deliveries. So much quicker when they're only getting small pieces at a time. So while we watch this, we're also making sure that if this does come back with a second spike in the fall, we're ready as well to have the needed PPE in the state.
This is an indicator, AJ, I think you'll agree, that has improved from the early days, right, where the supply chains just were overburdened. We didn't have the equipment in the warehouses, either federally or locally, and obviously as the demand was there and the production lines started to move, these vessels all kind of filled up, and where at one time we had a lot of unfilled vessels here.
No, there was great concern early on. Dr. Tay and her team was doing outreach with the medical community and the first responders to talk about how to preserve personal protective equipment and get a little bit more out of it. We are, like I said, we're in a comfortable spot right now. We're still looking to see what we could procure that made sense. And we also know that there's going to be, in the short term, there's still going to be an increased drain on PPEs. There's still COVID tests out there. We're going to use it at testing sites. First responders are going to use a little bit more than normal when they go on EMS or ambulance runs. So it's something we still, even though our cases are going down and our percent positive is going down, it's still something we have to keep a close eye on.
And sanitation material and cleaning materials and face masks that we're requiring in retailers and so many establishments that are going to be open is going to be a demand as well. And we're going to have put together those care kits for small businesses through their legislative leaders in those districts to make those distributions, and that's a good thing. So we're moving to phase one on June 1st on Monday. It'll be another beach weekend to prepare for this, and I think as we've engaged the real estate community, particularly there at the beach area, have some level of comfort based on what we saw last weekend and with this starting on Monday and what they normally see in terms of booking and arrangements in June. Feel like we'll have a phase in there, a ramp up that'll enable folks to get comfort with the new normal. The realtors and those in that industry have committed to being ambassadors to get the word out about appropriate behavior and social distancing and mask wearing, and they can be real partners with us. It's certainly in their business interest to do that, so people will come back. And we'll talk a little bit more about that idea of consumer confidence and confidence that the businesses will be safe as we engage with our private sector partners. So the reopening affects different industries differently. There's a lot of information on this chart. Essentially, most of the businesses in phase one will reopen at 30% of fire code occupancy limit. So it's a gradually open the doors with face coverings required. Particularly in the retail, we remind folks, if you're going to go into a retail establishment, that you need to be wearing a mask to protect the workers that are there. I've been in retail establishments that have been open, and they've got their plexiglass barriers there, and they're taking the precautions with marking out 6 feet social distancing at cashiers and checkouts centers. I would just advise everybody and ask everybody to think about people around you as you circulate in these folks that are opening up. Barber shops and hair salons, tanning salons will be open to 30% of fire code occupancy, appointment only, face covering required. Obviously, most folks know their barber well, or the salon they go to, and I'm sure are having communications with those folks about being safe. One of the big areas that there is some concern about, and Dr. Rattay is going to talk about it all, is exercise facilities, 30% fire code occupancy limit, face covering required unless doing certain strenuous exercises that makes that hard to do. And somebody who works out regularly at the YMCA can imagine what those might do. It might be hard to breathe on a treadmill but you do need to think about the things that we worry about: confined space, respiratory particles as people, exercise, and again, just to underscore the fact that we're not making these things up. These are public health principles to protect people from catching the virus. Casinos, again, one of the concerns in casinos is folks that sit at a machine, even though it's going to be 8 feet apart according to the guidance, but consistently, potentially an extended period of time of exposure, which is one of the issues. So if it's a passing exposure, not as great a risk. If it's an extended exposure, much greater risk, obviously closer together. Activities that involve singing, shouting, expressing oneself, where respiratory particles, talking like I am right now as those particles go forward. Parks and Rec has always been a challenge. It is outdoor. Again, outdoors compared to indoors is safer, and all this factors in. A lot of the playgrounds themselves, we're still working out that. We would recommend that they stay closed. I know that in our meeting and conversation with the mayors, they'd like that to be a consistent kind of policy when that's recommended, so that they don't have everybody coming to the playground in their town or their neighborhood. I know the playground near 2 blocks from where I live, across from Warner School, is still closed with yellow tape around it, and the basketball rim's still down because of the close contact of that. Child care will still be emergency child care sites only for the time being, and we'll be ready to ramp that up. Youth sports is something that we're working on increasingly. No contact sports and physical activities for children may resume. Strict social distancing, groups limited to 10. Coaches and staff must wear face coverings, no competition. This is an area of concern. Obviously, some sports are safer than others. We just need to work through this, and we'll continue to do that. Places of worship have been an area where there's been some controversy, so that see the additional guidance, which is found at de.gov/CW guidance, and which was released on May the 23rd. And then a number of things in phase one continue to be closed: school-based instruction, close contact personal services like tattoo parlors, summer camps. We are working on summer camps. That'll be something that we'll have more information on. Sporting facilities and venues, children's play areas, I mentioned that. We do have resources for reopening for small businesses in particular. They can get these signs that are designed for general use, and they can use it for their particular establishment. Again, just to keep the message out there. We saw a lot of really good signage there at the beach over the weekend, working with our town partners. They had some signs, and we had our signs that we had developed for them. And then we have a customer protection standards program to try to create a level of confidence in consumers. And here are the different things that we're asking retailers and business establishments to do. Staff wears mandated face coverings, staff washes and sanitizes their hands regularly, so on and so forth. And if a business establishment meets all these criteria, they got to win the Decal, basically a good housekeeping seal of approval that says COVID-19 customer protection standards met. And so we would encourage, I don't think we have to, frankly, encourage the businesses that I've talked to do this. In fact, I talked to Mayor Becker as the mayor of Lewis, and they've embraced in the town of Lewis this concept of a town ambassador program. We talked about it last week with respect to the beaches. I think it's a really good idea and a really good approach to education and educating the public and keeping the public focused on the things that they need to do. And again, that this is everyone's in this together kind of a approach, rather than a one man or woman themselves. So we have more information, as I said, coming forward in phase two for summer camps and summer schools. We're developing a plan for social distancing, frequent hand washing. The idea here, as I understand it, with summer camps and summer schools, is to keep the cohorts limited to 15 children plus staff, and to keep those cohorts together, as opposed to mixing larger numbers of children together to make contact tracing a little bit more difficult and to limit the potential for spread. And Dr. Rattay is shaking her head. She might want to comment on that. So again, going back to the fundamental message, we have to have a healthy community in order to have a healthy economy, and you can't have a healthy economy or a healthy community without a healthy economy. So they're intertwined and related. It's going to require widespread testing, which AJ and his public health contacts and community contacts are working on widespread testing, and we're moving into a new phase there. We're standing up the contact tracing part of that, which basically is identifying those who test positive for COVID-19 and interviewing them about who they've come in contact with, interviewing them and isolating those who are COVID-19 positive. So controlling the spread by identifying those who are positive and isolating them instead of isolating the whole community. So what phase one involves more lifting of more restrictions in phase one and opening of businesses at limited fire code capacity, and we're prepared to move into that based on the situation on the ground. So with that, I'll turn it over to, here's another side that I missed here, but it involves the idea of wearing a mask. You know, as I travel around the city of Wilmington, if you've heard me say this before, it's incredible to me on the street, the large percentage of people that are wearing a mask. And as this slide indicates, it does show that when you're wearing a mask, you're thinking about the person next to you, thinking about your neighbor, because it's as much about them, even more about them, than it is about you. And so one of the indicators as we move forward with how we're doing will be with what kind of compliance we continue to get with mask wearing in our state. So, Dr. Rattay.
Great, thank you, Governor. So, to kind of summarize the key points that you have been hearing from us, and you'll keep hearing. Most important things that we can do and we need to do to be able to reopen and safely reopen is, of course, stay home when you're sick and wash or hand sanitize on a regular basis. These are messages that we commonly use in public health for infection prevention. But some of the newer messages that you're hearing much more from us during COVID-19 relate to wearing a face covering and staying at least 6 feet apart. And as we have mentioned before, so much of this is really driven by how common asymptomatic spread is. Governor Carney was talking about this as a respiratory virus, and it is, and it's typically respiratory viruses are spread by coughing and sneezing. We know that, but we're also learning more about this virus being spread through speaking, especially loud speaking and even singing. And so these messages around wearing a mask and staying at least 6 feet apart are really, really important. Some of our other key risks are, of course, crowds, but crowds are certainly related to how distant you are. But what makes a huge difference is whether you're inside or outside. So crowds indoors are much higher risk for what is now called super spreading events, or more viral spread between people. So you'll hear us talk a lot about and recommending that people be outside as much as possible. Of course, we still want you to follow that advice. But this leads me to some of the other points that I think are really important to make. As we have been focused on COVID-19 so much, some of the other key messages that we often promote and talk about at this time of year have gotten lost a little bit. Someone was asking me yesterday, is COVID-19 spread through tick bites or mosquito bites? And the answer is no. As we discussed, it's a respiratory virus. However, tick bites and Lyme's disease is very prevalent here in Delaware, and of course we see mosquito-borne illnesses as well, like West Nile virus. So we just want to remind people to make sure that you do the things that you need to do to prevent tick bites and mosquito bites, like wearing light-colored clothing and long pants that you tuck into your socks, especially if you're in wooded areas. And then very, very importantly, apply repellent, insect repellent, especially EPA-approved DEET-containing repellent. That's very important for ticks. Additionally, for tick control, you want to make sure your grass doesn't get too long. You want to remove brush and tall weeds. You want to keep firewood, birdhouses, and feeders away from the home. And also, if you have a forested area or a wooded area on your property, you want to do your best to create kind of a separation, like a 3-foot separation between that wooded area and your normal lawn. That kind of barrier, like a gravel barrier, can make a big difference in keeping the ticks out of your lawn. But mosquito bites are also important. So again, that repellent, same repellent that we used for ticks, is extremely helpful, particularly at dusk. And also you want to make sure that you don't have standing sources of water in your backyard. So sun safety is also something we need to highlight. In Delaware, we have pretty high rates of skin cancer. And so using that sunscreen when you're outdoors and reapplying it frequently as per the instructions on the sunscreen container are really important for preventing sunscreen and for preventing skin cancer. So as you go out, in your bag, purse, whatever, make sure you have your sunscreen, as well as your insect repellent, along with your hand sanitizer and of course your face mask. So just want to remind people of that. And additionally, we've been looking at our data around vaccination for kids, and I'll go over that in just a minute. But we are, our data are really making it clear that we need to remind people that keeping up with well child visits for kids, especially kids under 2 years of age, is really important. Really important that our kids stay up with their vaccinations. Vaccine rates have fallen dramatically during the COVID-19 crisis. So, for example, for the Tdap, diphtheria, tetanus, and pertussis vaccine, you can see a decrease there in especially March and April. That's the tail end of this graph. And we see the same thing for polio. So see that big line that goes down, as well as our measles, mumps, and rubella vaccine, significant decrease, as well as our hepatitis A vaccine. And additionally, our chickenpox vaccine, or varicella vaccine. We're also seeing all of our childhood vaccines, especially those given in the first 2 years of life, have really taken a nosedive in the last few months. So now really is the time to, if your well child visit was canceled, get those rescheduled. I can tell you, as a pediatrician and a mom, I think our pediatric providers in the state are doing a great job in how they're handling bringing kids back into the offices. Many of them are doing a lot of teleconsultation services whenever they can. And then they're also finding safe ways, for example, to do drive-through vaccinations. So give your child's healthcare provider a call. Talk to them if you have any concerns or questions. Face coverings are recommended for kids 2 and up when they go for healthcare services. So again, check on that with your provider. But just want to remind people that it really is time to, if your child has gotten at all behind, make sure that you reschedule those visits to get them back up to date with their vaccination. And with that, I'm going to hand it back to the governor.
Thank you very much, and thank you again, as I try to do at every opportunity, for the great work that Public Health is doing. An amazing team there, just at every level, with so many balls in the air, so much to do that's so critically important over the last 3 months. And obviously, as we move into this new phase, it's going to change, but it's going to be as important, if not more important than ever, particularly the testing piece and the contact tracing piece, which is getting started by the Delaware Army and Air National Guard and ramping up pretty quickly. AJ?
Thank you, sir. So testing continues. Here, we understand there's a lot of testing going on out there. The state has increased our testing capacity in events. Newcastle County is utilizing some of their resources to manage their events here in Newcastle County, so that gives us ability to concentrate then just even more on Kent and Sussex rather than having to do the road show through the state. So what we have up here is our state testing events, plus some in Newcastle County, that are all being done by the saliva-based test that we purchased last month for the next 10 days, or first 10 days of June. These are all able to be signed up for online at the coronavirus.ce.gov website. You go on, you sign up, you look at what's close to your house, answer a few questions, get a confirmation, and then you're on your way. From the time you get to the testing site to the time you're out, it takes less than probably 10 minutes. This is for asymptomatic or symptomatic individuals. We don't want somebody delaying to come to one of these sites. If they have any symptoms, please reach out to your primary care provider. Call 211 if you don't have one, and we could see how we could assist you getting a test to a medical provider to get a test. So all these sites up here are the state-only sites with the assistance of Newcastle County. Our hospital partners continue to have their walk-in clinics and their drive-through clinics. That information as well is on the Delaware Division of Public Health website. It's also shared a lot on social media between a number of platforms. So these events, we don't want people to get confused. We don't want people to just look at something that's just in their backyard. There are rotating. Hopefully there's something in your neighborhood that will work for you. So as you see, between the next about 10, 12 days, we're anywhere from Claymont all the way down to Lewis and Bridgeville next week, in Dover, and then probably by next Tuesday's press conference, we will have the next week's events up there. So we continue to look for this throughout the summer with new sites popping up as the data that really public health provides helps us identify which neighborhoods we go to, so we have a balanced, a balanced approach to identifying communities. We talked a little bit the other day about the business-to-business toolkit that's at de.gov/coronavirus. A tool for businesses as we're entering phase one, which I think we're all excited about. People want to, get their shops back open. People need to get back to work, et cetera. We want to make sure people have the ability to reach out to new partners or new vendors that may not have known before to get the supplies they need, as the governor was referring to. So we are working diligently with our partners in the hospital systems to make sure we have the medical personal protective equipment on hand. And then we also have to make sure that the businesses, as they start up, have the needed equipment they need. So it's not necessarily the same face coverings or gloves, but there's certain equipment that's needed for the food industry, for food preparation. We want to make sure the cleaners are there, et cetera, and the face coverings that we know are important. So here we have the business-to-business toolkit that's up there that we hope people are taking advantage of. As well, we've partnered with the Division of Small Business to put together some kits for small business to help with the reopening. These will include hand sanitizers, about 20 to 25 face coverings for employees that are washable, and then some surface cleaner. We understand that the normal cleaning wipes that you would have that you use to clean countertops and stuff are probably not as available as they were before. We talked to our public health partners, bleach water and a paper towel works just as effective, and that's what we're doing. We're being creative. We're hopefully have something to help them reopen their stores or their businesses in the next few weeks and get a little bit back to normal. We're distributing these through partners across the state. We'll be giving some to each of the members of the General Assembly. We will be distributing to the 20 Main Street organizations, the 13 Chambers of Commerce in Delaware. The State Office of Supplier Diversity will have a few pallets distributed as needed to their partners, and the Division of Small Business. So our delivery schedule set up for next week to hit as many of these partners as we can by hopefully the end of next week. So touch base with them, and I think we did about 5,500, about 6,000 kits. So hopefully those businesses that need that help to open the doors back up have a little bit of cleaning supplies, face coverings, et cetera, to help them open their doors. Everything we have done since March, whether it's the testing, whether it's putting some of these care kits together for businesses, or what we've done for our testing locations, to the food delivery for school districts that wanted to make sure their students still got their lunches through the second half of the year, couldn't have been possible without the Delaware National Guard. Right now we have about 200 Guard members that are on Title 32 status, so they're under the governor's direction, but getting funded from our federal partners. So this is a huge population of individuals that we have been able to lean on for a dozen different tasks, not just the contract mapping that they're doing to assist public health with, but from personal protective equipment distribution and packaging of the push packages we've done, to the testing, to the food distribution, to working at the Delaware Food Bank sites, in addition to the school ones we've done. So, kudos to General Berries and his team, because they really have brought the boots to the ground, no pun intended, to help us in a number of ways. So we can't appreciate them well enough. And not just the National Guard. We have had our the volunteer organizations active in disaster, we refer to as VOED. There are a number of the nonprofits that have really helped the state, come up with creative solutions for a number of problems. And it's not going to end on Monday as we enter phase one. I think we're going to see the demand for some of these services still continue on. And with our partners at the VOAD and Office of Volunteerism and National Guard, we're going to do what we can to support every Delawarean as we go forward. So, Governor, that is it.
Thank you very much, Director Shaw. Thank you for your great work, particularly now as we discuss a different way of approaching testing. It's more difficult, I think, because we've got more partners. It's more difficult. We got more requests from individual members of the community, be it church leaders, be it civic leaders, be it members of the General Assembly and local elected officials, working with public health. We're going to make those decisions based on the data, where those tests are needed the most, how much we've tested in various areas, trying to balance all that out. Again, using science as we have from the beginning, and being as responsive to the people that we work for as we possibly can in terms of addressing concerns that people have and helping people understand the situation on the ground wherever they live. And I would recommend to everybody to visit the website, My Healthy Community, which can be reached over de.gov/coronavirus. All the information we talked about is there. And it's got great information there broken down by demographics, by age, by race, by ethnicity, by geography. You can get on your individual representative district, you can get your town, your municipality, even some general areas like Trinity vicinity or the east side, the west side, and the city of Wilmington and other communities across our state. Really good information. I can't say enough about the Army and Air National Guard, the men and women in uniform who've been just really tremendous, whether they're working at the Delaware Psychiatric Center, providing confidence to the employees at a time where they really needed it, whether they're working to stand up the alternative care sites outside of the hospitals, at Nemours and in other places, or wherever they've been used in our testing sites and now in contact tracing. We do really appreciate it. I had the opportunity to thank the Secretary of Defense, Secretary Esper, yesterday on the phone about the Guard and their important role in all this. And then all of our partners, from the hospitals to the mayors. The mayor's group has been fantastic, every single one, particularly those at the beach communities. Speaker Schwarzkopf has been a great partner with he and Majority Leader Longhurst and their whole team in the House, keeping us up to date what's happening on the ground, local elected officials, the mayor, the county executive now with the resources there, and all the frontline workers, both in the healthcare facilities and the rest. Thank you for all that you are doing and will continue to do. And then mostly for everybody else, you really have done what it's taken to flatten the curve, to reduce the spread. We are in a position, to those who question whether we're ready to move to phase one. We are ready to move to phase one. We've taken a number of interim steps. We had a great weekend last weekend at the beach. We know we have challenges ahead. And our success will depend on whether we're able to recognize that we're all in this together. And that it really is not every man or woman for himself, that we're going to beat this thing by coming together, much like military battle units do it as a unit and not as individuals. And if we take that attitude, we're going to be successful. We'll probably have some setbacks, and we'll learn from those, but we'll continue to be guided by the public health science and by the dual objectives of a strong, healthy community as well as a strong economy. So be smart, wash your hands, wear your face covering, show folks that you care, practice social distancing, and protect your neighbors. And with that, Meredith, thanks for coming, and all the other media outlets with us today.
Hello. Earlier this month, Governor, you said the state had the goal of conducting 80,000 tests a month. I'm curious when you expect the state to hit that mark.
Yeah, it's a very aggressive goal. As you can see, the numbers we're already almost doubling on a week-to-week basis the number of tests that we've done, And I don't have a time frame. I think it's going to be a challenge, though, particularly as people maybe get complacent and think they don't have to get tested. We're going to make up for that, I think, in part by kind of really intense testing on nursing care workers, on essential personnel and those on the front lines. I mean, if you think about the objective here and the means of achieving that objective, you really do have to lean into these kind of unique at-risk workers and populations, right? One thing, just looking back at our experience over the last 3 months, that's where it takes you. And to protect those vulnerables. And the way we don't have a vaccine to protect them. So we've got to test, isolate, and contact trace to protect them and, more importantly, to protect their neighbors. And then these other protective measures like face mask wearing and social distancing. So, AJ, you want to comment? It's your job to get it up to 80,000.
It is. I'm clicking every one. But no, I think that there's a good point there. We have doubled it just over the last, I think I said Tuesday. So the looking back from Tuesday, 2 weeks, compared to the 2 weeks previous to that, we more than doubled what we were doing on average per day. The other thing, we are going to have to get more targeting with some of these community locations that we pick. Yesterday, we had an event in Western Kent County where we could have done over 1,000 people, and we had about 500, and I want to say a little bit under 500 that actually showed up. So just because we build it doesn't mean they're going to come. So it is, we will have we'll put it this way, we're going to be able to test whoever wants to be tested. I think Dr. Atay and Dr. Pescatore and Dr. Hong are going to help us find those areas that we need to get to. But my concern is kind of what the governor shared is, if we enter phase 1 and we still see hospitalizations low, we see the infection percent positive stay low, I wonder how many times we're going to be standing around some of these sites. But we want to make sure people have an avenue somewhere in their neighborhood, within every 10, 12 days that they can get tested if they want to. And I'll let Dr. Atay see what I missed.
Yeah, and I'll just say one other thing. We've got to nip these outbreaks in the bud. And that's the challenge, and we've talked about that today and different ways of doing that. But testing is one way.
Yeah, I don't have a lot to add other than the targeted approach is really important, but I think I'm pretty impressed with how we have been able, and thanks to AJ's leadership, to really increase testing over the last few weeks. It's certainly a relief to all of us to not feel the shortage of testing supplies that we dealt with for so long. So now it's just making sure that we're strategic in the way we use, all of our resources to test the people that need to be tested the most.
And
just one more thing, I think. So instead of seeing these big drive-throughs, we might see more of something smaller scale that we're doing in locations. And just to clarify, the testing sites that we posted on the slide from June 1st to 10th, not all of them links are live yet to stand up on. This is hot off the press as we just confirmed the last 2 sites this morning, so they will be live by this evening for people to sign up. So while we're talking testing, I wanted to get that reminder.
One more testing follow-up.
Yep.
So with I think it was 200,000 tests that the state had purchased, are those currently in the state's possession?
Yes.
Okay.
Yes, so all the slide we showed today are all the tests that you're referring to. Our hospital partners are still using their labs, their testing kits, et cetera.
AJ, why don't you explain real briefly how it's because it's easily to administer? And
So, yeah, exactly. So, people have asked us, why do we spend so much for a test? And it was a out-of-the-box solution, I guess we would say. So the cost we paid per test included all the media that we needed to get complete the test. So I've learned more about lab work in the last 3 months than I thought I'd ever know. So it has it has a swab, it has the viral, it has the reagent. So it comes complete and includes the lab processing it. It includes the software where people are able to go on, log in, confirm a spot for themselves, and then results are delivered within about 24 hours once we get the kits to the lab by email. So prior to the person getting a phone call, which sometimes might take a few days because of the backlog of calling everybody individually, they're going to get an email probably 24 to 36 hours after they go through their test. So the efficiencies, we need a much smaller footprint of personnel at these sites to run it. So the economy comes with the ease of the kit versus having a lot of people that are entering information by hand or writing down sheets, and then public health having to enter it and have to call those people post-test.
And with the guidance encouraging businesses to set up plans for testing, does that include the poultry plants? And is it really up to the plants at this point to determine how and when they'll do testing for their workers?
Yeah, that's something we need to follow up on and sort out. It should be the plant responsibility at this point. We're obviously willing to partner with them and to make available, public testing sites for that. As I said, as we work through this, and I will continue to believe that history will show that the overall effort with respect to that outbreak was one of the more notable parts in terms of partnership, and there were some rough spots, no question. But moving to the next management phase of things, how do you test people regularly? Do they get tested by the company? Do they get tested in our community sites is something that we're going to have to work out, but a critical piece of it.
And just in terms of nursing homes having to test workers every week, that's required by the state, why is that opposed to poultry plants not having that requirement? Is it because of just the federal money and CMS regulations, or is it just a decision that the state has made considering what's going on?
Vulnerable populations. If you think about all the criteria for a phase 1 opening, one of the most important was really protecting the vulnerable populations. And the data is the people who die are people in nursing homes and people that are elderly with frail, health conditions. Notwithstanding the very high COVID-19 positive rates in the poultry worker population, the number of hospitalizations and deaths is very small. And so it's kind of a risk management thing, and what that tells you is really lean into the nursing home and that really elderly, frail population.
And I think some people, when you announced the new lifts on certain restrictions, were surprised to see that outdoor events of up to 250 people would be allowed. What's the rationale behind that? And was there any data indicating that with social distancing, wearing a mask, community spread isn't the concern it once was?
Yeah, well, I'll hand that off to Dr. Rattay, but it's mostly about respiratory particles in a confined space versus an open space.
Oh, he got it. Yeah, there's such a big difference between being outdoors and being indoors. That's not to say that there's not a risk for being outdoors. So with the outdoor guidance, certainly the 6-foot social distancing and face covering, especially when social distancing is difficult, but really face covering should be recommended for everyone in those events. And also, the guidance also, it says unenclosed areas, which I think is an important point, because unenclosed areas, a large field, it allows for people to be spread out from one another. So that's really key to that, is people being able to spread out, cover their face, especially if they're closer, and being outdoor is really key.
Thanks, Meredith.
A couple more questions. First from Tom Lehman at WBOC. A judge is expected to rule in the case on religious service restrictions today. What are your concerns should they be overturned?
Well, obviously, there's a lot at stake there. Our guidance has been driven by the imperative of protecting public health and not putting people at risk. I didn't hear the hearing yesterday, but there are obviously important issues. I would just hope that whatever the decision is doesn't put people at risk. And that it enables certain public health objectives to be balanced off with other rights and practices. But our focus was not on ever on, controlling religious practice. Actually, just the opposite, enabling religious practice in a time where public health is a great concern. I think the biggest issue, which I don't know whether it will be in the mind of the judge, is that in so many religious congregations, a significant proportion of the congregants are individuals in vulnerable populations, our senior citizens and elderly that are regular worshipers, and that's a concern that I have, that whatever the decision is, that we'll be able to protect those populations. And I do have considerable confidence in our religious leaders based on the conversations that I've had with them over the last several weeks with respect to these restrictions and limitations. And just about everyone, other than some that I read about in the paper, were very cautious and understood that their obligation was not just a spiritual one, but one of physical health as well.
From the Delaware Public Media, how much did the state spend on field hospitals that were never used? Are those surge capacity facilities still up? And if so, when might they be dismantled?
Yeah, so I don't know if we have a number. I'll turn it to AJ in a minute, but the facility we stood up at Nemours as a surge capacity site here in Newcastle County was done by the Army and Air Guard, and so would be reimbursable. We did use Governor Bacon for a certain care, and we did most of that with existing resources, and so I don't know that there are huge expenses there, AJ?
I think you did. Anything that was done was minimal compared to what other sites, if we went out and retrofitted a school gym or something like that. Most of the supplies we used up at Nemours, if they weren't from the Nemours themselves, it was from the inventory of public health. There was some equipment, I think, that was purchased for the guards, some scrubs and stuff like that, but I would say very minimal expense compared to what they did. And the guard was up there for a while. They did train with Nemours in case they had to turn that on to make sure they understood their medical system, the way their pharmacy worked, x-rays, et cetera. Nemours is committed where if for some reason something bad would happen, Dr. Greenspan has, kind of said, hey, we put stuff away, but it's able to, we know what the plan is now, we can turn it back on if needed. So it's a good lesson learned as well.
So that one's been mothballed. The other one's still available, but I don't know that it's much used at Governor Bacon.
Final question for today is from Jacqueline Lee at 6ABC. Can the governor address the possibility of an influx of out-of-staters visiting when Delaware reopens on Monday? Does the state welcome them with open arms or ask that they not visit? And for citizens who feel unsafe with how quickly things are opening up, what assurances can be given to ensure their safety?
Yeah, so that in some ways encapsulates the challenge that we have, right, is helping assure Delawareans that they're safe, that the conditions on the ground are such that we feel like we have control of the spread in such a way that we can allow the opening of sectors of the economy that have been closed, and 30% to capacity in most cases in terms of restaurants and retailers and other establishments. And again, that has to be, their closure has to be balanced off with the economic damage that's being created there, both for the employer and for the employee. And I believe, and that's why we show the numbers at each of these press conferences, we start off with that the percent positive cases has continued to decline. The number of active cases, if you will, have stabilized. Deaths continue to rise, but that's clearly a lagging indicator, terrible thing for each one, but not really one to make judgments on as to what to do tomorrow or the next day. And so I think everybody, are we hesitant in some ways? Are we cautious about moving forward? Absolutely, which is why we've put restrictions based on those concerns about keeping people separate, not having large gatherings, making sure that people wear face coverings, But in order to have a healthy community, a healthy state, we have to have a strong economy. We have to have an economy that's working again so folks can go back to work and earn their living. Businesses can get back to doing what they do best. And part of that involves visitors coming from out of state. And so we do welcome visitors back. We would ask them to follow the rules and the guidelines and enjoy themselves in a safe way if they're visiting beaches or wherever that might be in our state. We want to do that gradually, and so through the month of June, as people gradually come back to our state, that would be a very positive thing. Obviously, ultimately, at the end of the day, certain businesses won't be successful without visitors from states around us. I'm confident, based on my meetings with coastal town mayors and what I saw in Rehoboth Beach last weekend and what I see from business owners and retailers across our state, I have a level of confidence that we can do this and we can do it in a safe way, and those businesses can operate again and employees can go back to work. It's gonna be a new normal that's different than before. We still, as I said, need to keep separate from one another by 6 feet and wear face coverings and be conscious of your neighbor, and large gatherings are still not a good idea. And so if folks follow that and think about their neighbor, we're going to be okay. So thank you all, and we'll see you next week.